The sleep recommendation for women our age is about 7 to 9 hours per night. No surprise. But according to the CDC, unfortunately, fewer than 2/3 of women actually get that much sleep each night. Even one night of poor sleep causes trouble with memory and concentration. You get daytime sleepiness and impaired performance at work. And it's not just about getting the right number of hours, it's also about the quality of sleep. And researchers have found that women experience lower quality of sleep than men do. I knew it was important because of all of this to ensure that we had a board-certified sleep expert on the podcast. And boy, do I love his passion and energy. Health, wellness, career, family, life, and the better side of 50. I'm your host, Michelle Folan, and this is Asking for a Friend. Hello, listeners. Our guest expert today is a quadruple board-certified physician specializing in internal medicine, pulmonology, critical care, and sleep medicine. He practices at the University of Southern California, where he is an associate professor of clinical medicine, assistant program director of the internal medicine residency program, and the associate program director of the sleep medicine fellowship. He is an active clinical researcher and has been teaching around the world for more than 18 years. Welcome, Dr. Raj Dasgupta.
Hey, Michelle, what's going on?
Oh, it's so nice to meet you. And is it okay if I just call you Dr. Raj?
Oh my God, you are so nice. Even if you didn't put the doctor in front, I would still love you.
Okay.
So it doesn't matter.
I appreciate that.
You're welcome.
And I think just for the listeners, tell us just a little bit more about yourself.
I am a Trojan right now. Fight on. I made the little Trojan peace sign, Teaching's my jam, and I've been doing that for literally what my bio says for 18, almost 20 years. And I teach a lot of medical students, but I really feel education's for everyone. So if you told me you're a doctor, a nurse practitioner, whatever it is, I would say, yes, I love just teaching medicine. I live in LA, so about 7 years ago, I got bit by the TB bug, and I don't think I'm going to call it TB anymore. I was really fortunate to be on TV shows, and it brought out the journalist in me, brought out the, hey, I want to start talking about letting everyone know about good health and wellness. And so I had the opportunity to be working with awesome people, like I got to mention her, Ann Curry. We did a TV show together called Chasing the Cure. And here I am today with you, Michelle, to talk about things that I'm passionate about, sleep, women's health. I think this is a perfect combo.
Oh, this is perfect. Great segue into sleep, because sleep is a huge issue for women in this midlife age group. So can you put some color around why that is and why we're waking up at 3:30 in the morning or can't get to sleep at all?
Well, let me throw out with some key words and phrases I really believe in. Number one, sleep is not a luxury. You need sleep. And when we talk about the phrase of pillars of health, I think that we know that there's going to be diet and exercise and people that have an appropriate weight. And sleep is right up there. And people always ask me, well, hey, I'm working really hard during the day. Why does sleep factor into that? And I throw out the stat that we sleep a third of our lives. So I hope everyone listening today lives to around 90 years really healthy. But if you take a third of 90 years, that's 30 years of sleep. So you can imagine what happens at night really affects during the day. This is going to lead into the question, well, how much should I sleep? And of course, it really depends on how old you are. For us, me and Michelle, it's going to be around 7 to 9 hours, according to the American Academy of Sleep Medicine. But for peds, for young kids, it's going to be much more. But to address your question, Michelle, as we get older, people don't realize sleep is just as important, just as essential. And as we get older, it's hard to get the good quantity sleep and hard to get the good quality sleep. And quality is defined as getting to a deeper stage of sleep, getting some REM sleep. And you know who's got a real tough time getting sleep as you get older? Women.
Yeah.
And it's not like a big secret. You know what I mean? I think all of us need it, but women get it harder. I'm going to throw out one word, and it's going to be menopause. It's not just that exact time of menopause, it's perimenopausal. And of course, What's driving difficult sleep as we get older? It's going to be hormones. And I know your listeners know what I'm going to say. I mean, you folks are smart. It's going to be estrogen, right? And when you don't have that estrogen, that's what menopause is that you're going to be more predisposed to obstructive sleep apnea. Ugh, that's more than just snoring. You're going to be having sweats at night, some pretty bad sweats at night. That'll keep me up at night. And just by being older, whether you're a man or a woman, you have multiple awakenings throughout the night. It's hard to initiate sleep. Let me just throw one more thing, whether you're a man or a woman, is that as all of us get older, look at the medicine cabinet. I mean, look at the amount of drugs that we're taking as we get older. All these different things factor in. Sleep is very precious. And yes, it is tough as women get older around that perimenopausal time to get good quality and quantity sleep.
So you mentioned estrogen. Do you sometimes recommend for women in this age group to go get a full hormonal workup if they are sleeping really poorly?
Great, super duper question. Number one, when we talk about estrogen, I wish it was as simple as, hey, everyone, just go and take some estrogen. That's a big super no because estrogen has so many side effects. The one that jumps out to my mind, if there's med students listening, is always clotting. You could get DVTs, deep vein thrombosis, that could lead to pulmonary embolism and clots everywhere. So anytime you're taking anything when you're perimenopausal, postmenopausal, you definitely need to tell your health care provider, especially estrogen. I know there's going to be over-the-counter medications that sometimes many women have tried. And the one that always jumps to mind, I don't know why, is like black cohosh for some reason. Any drug, even if it's going to be an herbal supplement, you want to let your physician or healthcare provider know there could be drug interactions. And many individuals will take antidepressants, not because they're depressed per se, but some of the secondary effects of being on antidepressants when you're going to be perimenopausal. Let your physician know. As far as checking hormones are concerned, just the other day, had a patient in the outpatient setting talking about getting older and being fatigued. And fatigued is such a broad word. What can it mean? I think there are certain things that need to be evaluated when you get older. And I'm going to be a little slighted towards women on here. I mean, you got to check those iron levels. You got to get a CBC. What is your hemoglobin? That can give you shortness of breath. That can make you fatigued. There's another hormone called the thyroid. And it's not like a big secret. Men more than women have some thyroid issues. And that could go under the radar, and that could cause sleep issues, and that can cause fatigue. You want to check these things. Now, when we talk about specifically checking estrogen, progesterone, plus or minus testosterone, you want to be under the care of maybe an endocrinologist, because what are you going to do with these values? How are you going to change your management? And taking supplemental hormones definitely has its consequences. So to answer your question directly, I'll order it when it's in my comfort zone. I'm always game on for a vitamin D level and a CBC and TSH. But when we start talking about estrogen, I'll probably leave it to an endocrinologist.
Do vitamin D levels impact sleep as well?
I'm going to say it's going to be A equals B, or the big word that we like to use to make sure we say the right thing is associations. And I would say poor quantity and quality sleep are associated with many things. Vitamin D wouldn't be the highest on my list, but when I think of women, what jumps to mind? Osteoporosis, osteopenia, bone health. And it's amazing. My big joke is I live in California and I'm vitamin D deficient. It seems backwards. You know what I mean? I'm definitely pro checking a level. It's going to be called the 25 vitamin D level. There's a limit you need to be at. And I think women especially, should be at their appropriate vitamin D level, especially if you're going to be taking calcium supplement, you're taking medications for osteoporosis. Bone health is very, very important.
Yeah, and I'm going to have to cover that on a whole nother show because that is on my list of topics.
Michelle, get my wife on here. So she's a rheumatologist.
Oh, okay.
So she's all about osteoporosis and anemia and bone health. She'll blow my knowledge out of the water, man.
Okay. Tell her I'll be sending her an email.
Okay.
You started talking a little bit about vitamin D and maybe some over-the-counter type supplements. That brought to mind melatonin.
Yeah. Okay. I got to tell you, there's been a big push right now, and a really awesome article came out in CNN that, wow, we're abusing melatonin. It doesn't surprise me, and I hope it doesn't surprise you, because you just get it over the counter. And it doesn't even look like a pill nowadays, Michelle. It looks like a gummy bear. It looks like chewing gum. There's actually a melatonin patch. We sell it to our kids, so of course people don't take it seriously. When melatonin, everyone, is not a FDA approved drug, it's a dietary supplement. And of course, number one, let me just throw it out there because it's not regulated. Are you really getting 100% pure melatonin? This is exactly the dose you're taking. And I'll say this, that when it comes to taking melatonin, it's not how high you crank the dose. It's really the timing of the melatonin, because melatonin is a hormone that's natural in your body, secreted by the pineal gland, really works hand in hand with your circadian rhythm. And to really super simplify it, it just means that what makes our sleep schedule entrained to the 24-hour solar day is sunlight. So in the morning, I always tell people, get out of bed, you know what I mean? Especially if you're here in California. And when you see that sunlight, it's going to suppress the release of melatonin. And as you get towards the evening, then that lack of sunlight, especially that lack of blue light, which is a different wavelength of light, causes melatonin to get released. So you time the melatonin appropriately to slowly nudge your circadian rhythm one way or the other. When we talk about dosing, my favorite dose for an adult like me and Michelle is around the 3 milligram-ish dose. But of course, my theme in life for kids and the elderly is start low and go slow. But when I hear people taking 5 to 10 milligrams of melatonin, it's not their fault. It comes in 10 milligrams over the counter. I'm like, whoa, that's a lot. And when I see college students take melatonin, you just tell them to take it at night. College students going to bed at like 4 in the morning and popping their melatonin, a little backwards what we should be doing. It's another thing where it does have side effects, not the most detrimental per se, but it does. You can have drug-drug interactions. Don't take it with alcohol. Just play it safe and talk to a pharmacist, a healthcare provider, your sleep doctor to find out what dose and when, and is it indicated in you to be taking melatonin?
Okay. One of the questions I got from one of the listeners was, if I'm taking melatonin, am I decreasing my body's ability to make its own melatonin?
Well, you definitely got some smart listeners. I love that one.
I do. I get really good questions. I got a couple more for you. So just you wait.
I like it. So the answer is no. When you take it in the realm of endocrinology, of course, thinking about steroids, taking cortisol, taking glucocorticoids, sure, when you're taking exogenous steroids, it prevents the release of the natural cortisol in your body. But that doesn't carry over to every single hormone. And it doesn't carry over to melatonin. The thought process is good, but no. Stick to, do I need to take it? And let me just say that who needs to take it is in certain types of insomnia, after utilizing the basics of insomnia, which is cognitive behavioral therapy. That's the main thing for any type of insomnia. Maybe melatonin could be a part of that. Switching your circadian rhythm one way or another could help out with melatonin. But when I hear people taking melatonin for obstructive sleep apnea, or it just doesn't make a lot of sense for me. So talk to someone.
Okay. The other question I got was magnesium glycinate.
Nice. Right under that whole herbal supplements, I got to tell you, here's going to be a list of things I hear all the time. Valerian root, chamomile tea, tryptophan, taking hops, and of course, you talk about magnesium. So magnesium in itself is a muscle relaxant, and don't get me wrong, you definitely want to be relaxed both mentally and physically when you want to get a good night's sleep. Now, in broad strokes, there's a daily recommended amount of magnesium that anyone needs to take, and most of us get that with just our natural dietary what we eat. So I don't believe in super therapeutic levels making a big difference. When you take magnesium over the counter, is that 1 or 2 pills going to do anything bad? The answer is no. Is there probably some very small data here and there that says it may benefit? Sure. Should it be combined with cognitive behavioral therapy? Why not? But I think with a lot of these over-the-counter herbal supplements, it's always going to be, is this going to be an awesome double-blinded randomized controlled trial? And the answer is chances are we don't have that kind of evidence. And therefore the question becomes, what dose, what route, what form, what time, who's the patient? There's worse things you could take. I mean, if it works for some individual, be sure to tell your physician. But no, the data is kind of when it comes to all these herbal supplements.
Okay. I was just saying, well, it might help you go to the bathroom in the morning too. Just a thought. We talk about circadian rhythm, getting outside, and really the role of getting sunlight to help with that. That's kind of part of good sleep hygiene. What else would you recommend in regard to sleep hygiene that people should be really paying attention to?
Cool. This is kind of one of my little pet peeves. There's sleep hygiene and there's cognitive behavioral therapy. When we talk about how do you treat insomnia, when I say insomnia, we all get some acute insomnia. I mean, Dr. Raj loves getting acute insomnia from time to time. But chronic insomnia by the American Academy of Sleep Medicine is having symptoms such as difficulty initiating and maintaining sleep almost 3 times a week for 3 months. So I'm really going to make my statements based on chronic insomnia. So when we talk about sleep hygiene in itself does not cure chronic insomnia. Don't want to make anyone sad out there. The only thing that really cures chronic insomnia is going to be cognitive behavioral therapy, and you definitely want to combine that with the sleep hygiene. When we talk about sleep hygiene, we all could use it, especially if you think that you want to set yourself up for the best chance of getting some good slumber. Well, sleep hygiene is the 3 rules of making the room dark and quiet and cool, all easier said than done. And when we talk about cognitive behavioral therapy, cognition means the way you think. Behaviors are literally your actions and behaviors. What are going to be my 2 favorite ones to combine with good sleep hygiene? I would say it's called stimulus control. What does that mean? The bed is only meant for one thing, and that is sleeping. I know what your listeners are thinking. It's not for that, but it's only meant for sleeping. And if you can't fall asleep within 15 to 20 minutes, you should leave the bed if possible. Do things that are non-stimulating in dim light and only go back to bed when you're ready to sleep, because you want to associate the bed with sleeping. You don't want to go to bed and your mind's already thinking, hey, where's my Scrabble board? Hey, where's my iPhone? You want to think about sleep. And the other thing for our behaviors is called sleep restriction. And what does that mean is that you want to have a set bedtime and set wake time and be consistent about it. This includes the weekends. This includes holidays. I think the big thing is that when we talk about being consistent, you got to get the family involved. So I'm married. I got 3 kids. And you could only take your behavioral therapy so far unless everyone's on board. So let's say on a Friday night, my wife is working her butt off. We got the kids. Our treat for each other isn't most times, let's stay up super late and binge watch, Ozark or something, though that's very tempting. What our reward is getting everyone out of bed on Saturday in the morning, trying to get outside, doing a walk in the park. But these are things that you want to do to try to keep that consistency. For your listeners, everyone can benefit from sleep hygiene. If you do suffer from chronic insomnia, that's not the only answer. You have to combine that with cognitive behavioral therapy. And sometimes for some of the listeners who have really, really bad insomnia, yes, sometimes you got to see me, and sometimes you do have to use medications in a temporary basis.
So you're telling me my nap on Sunday afternoon is probably not a great idea.
I love it. And now, great statement, because napping, let me just say this, everyone. If you're sleep deprived, take a nap. But if you have insomnia, I can't say I'm pro napping. You know why? You want to build up that drive to sleep at night. And if you do nap, you may take away the drive to sleep at night. But Michelle, let me ask you a question. I'm just curious. How long should a nap be for your listeners? I'll let you answer this one.
I would say no more than 20 minutes. That's what you're going to tell me.
Well, you did your research. You're spot on.
I don't live by that, Dr. Raj.
No, I think you're one of my favorite med students. All right. When would be the best time to nap if you have to nap during the day, Michelle?
Probably as far away from bedtime as possible.
You're right. And there's a word called a power nap. And a power nap historically is between 12 and 2 p.m., which is why many people feel a little sleepy around that lunchtime. And that coincides with our circadian rhythm. Our circadian rhythm makes us feel sleepy twice during the day, once around the 12 to 2 zone and once again at night. So if you're going to take a power nap, it should be around 20 minutes, and it should be around that noon to 2 p.m. zone to utilize when your circadian rhythm makes you feel sleepy anyways. And Michelle, have you ever heard of something called a caffeine nap?
I have not.
Yeah, I can tell the look on your face. You're like, cool, new material for the podcast, dude.
Yeah.
So, folks, I'm not encouraging any of this stuff, but there is something called a caffeine nap. And what happens is that, before you go to bed, bed, meaning taking a nap, of course, you could drink a caffeine, let's say a cup of coffee. And you'd be like, why? Because it takes around 20 minutes for the caffeine to kick in, right? You just don't drink it and boom, there you go. So what happens is if you drink a little caffeine before you take your nap, well, you're going to get the refreshness of the nap, which should be around 15 to 20 minutes. And then when you wake up, the alertness of the caffeine kicks in. So you get the best of both worlds. But what's that they say on TV? Don't try this at home, kids.
Yeah.
You know?
But I'm kind of intrigued now because obviously during the week, I can't be napping noon to 2, but that is something to think about trying. And I like the premise of it. In regard to caffeine, though, how late in the day is usually safe to drink it and still be able to get a good night's sleep?
So, of course, my answer is, well, who are we talking about? And I always think about sleep is so individualized. I'm sure everyone listening has a bed partner or a friend, and you're like, how can you sleep through that dump truck?
Right.
And so everyone's a little different. That's where all these words come out, deep sleeper and light sleeper. When we talk about caffeine, there is also a daily recommended allowance of how much you should be taking. If someone per se is really, really suffering from insomnia, I mean, the answer is don't drink caffeine at all. Ugh, I know. I'm like doing this podcast drinking coffee, but it's just true. I mean, if you're really suffering from it, the least you have it, the better. If you want to play just a standardized, what is the general rule of thumb? I would say don't drink caffeine within 6 hours of going to bed, 6 to 8 hours. That's just a good rule of thumb. Your last cup is going to be where somewhere around the noon to 2 o'clock where your circadian rhythm's dipping down. You need that cup. Then after 2 o'clock again, you just got to tough it out, because if you do take that caffeine too late in the day, of course, it's a stimulant. You'll have a difficult time initiating sleep. And remember one more thing is that when we talk about caffeine in itself, it's not the more you drink, the more alert you're going to get. People, that's one of the biggest misnomers out there, that you only get so much benefit of the alerting effects of caffeine. Then once you exceed that, the more cups of coffee or the more energy drinks, whatever it is you take, you're going to get all the negative side effects of the caffeine, and the alerting effects don't go up. So your heart rate's going to jump up. You're definitely going to have higher blood pressure. You're going to be irritated, but you're not going to be more awake. So just like melatonin, more is not better.
Oh, this is great advice. You were saying about caffeine and how late in the day. We all have that one friend that can drink a double espresso at 10 o'clock at night and sleep like a baby. And I don't get it, but.
Let me throw something else up there. So last night, I had a little business meeting. So I met with some folks, and they brought me to, I got to tell you, I love a good steak. And I went to the Ruth Chris Steakhouse last night. If you really want to get some really good heartburn when you go home, go to the Ruth Chris Steakhouse, because you're eating carbs, and then there's a steak. And then when the meal is done, they ask if you want coffee. Then there's this mint, and all these things give you heartburn. And why am I bringing this up? Sleep. If you're asking me what is one of the hardest things to initiate sleep, is having poorly controlled gastroesophageal reflux. And then there's one person at the table, I'm not going to call her name out or anything, got the coffee at 9 o'clock at night. I'm like, are you kidding me? You didn't notice that? You're talking to one of the sleep doctors here, but you're right. People do it, and it blows my mind,
Yeah. Not this girl, let me tell you that. I have a question from one of the listeners. She said, my husband started telling me recently that I stop breathing and gasp at night. She says, I assume I have sleep apnea, but is this a big issue? And long-term, is this something I need to worry about?
Oh, man, I'm glad we're touching base on this. So even though we all call it sleep apnea, for a teaching moment here, there are two types of sleep apnea. Central sleep apnea, which is very, very, very rare, thank God. And then obstructive sleep apnea. So usually when I got the medical students around me, I'm always like, call it OSA, because you don't want to confuse central. And you're right, 30 million Americans suffer from obstructive sleep apnea. And that number is definitely, I think we're undiagnosing a couple of people, and I think we're misdiagnosing a couple of people. So I think that number should be higher. So before I jump into what is obstructive sleep apnea, number one, it's not glorified snoring. When I have patients in front of me, I always say, snoring will probably kill your bed partner, but it won't kill you. But obstructive sleep apnea, that's going to do a number on you in the acute sense and the chronic sense. So obstructive sleep apnea is what it sounds like. There's an obstruction to airflow. Air can't get into the lungs, into the body, or out. And where's the obstruction in obstructive sleep apnea? It's not in the gut. It's in the back of the airway. So this whole misnomer that only overweight people, obese people get obstructive sleep apnea is wrong. People like you, Michelle, people like me, we are at risk because maybe I have a big tongue. Maybe, Michelle, you got huge tonsils in the uvula and a soft palate. You don't know. And that's why when someone says buzzwords, you got to make sure that it's not OSA. So what is one of the classic questionnaires I use? It's called the Stop Bang questionnaire. I'm not going to go through the whole thing, but the S in the Stop Bang stands for snoring. So snoring is very, very common. T is for like tired during the day. So there's all these different things there, but it's a good questionnaire. You could ask yourself. You could go to google.com. You'll see the questionnaire. Before I start treating someone for snoring, I'll do a sleep study. And when we talk about sleep studies, that it doesn't have to be the one you think where you come to my lab, you sleep in my lab, I put all these electrodes on your head, you look like Frankenstein. No, we have home sleep studies now. It's super game changer.
Really?
Yeah.
Oh, I didn't know that. Okay.
It's awesome. So basically, they're very minimally invasive. You go home, and at least at USC, we let you keep the device for 3 days. So you're sleeping in your own bed, your own pillow, and it really mimics what you're doing. It's a really good test that will rule in and rule out obstructive sleep apnea. One more thing, because I want to bring something about women over here, is that data, and this is something that's been known with the American Academy of Sleep Medicine, many people, including me, we do a horrible job in identifying obstructive sleep apnea in women because I know women present a little differently. I think if we're only going to be asking, do you snore? I don't think that's the right thing. Women could present with just fatigue, symptoms of depression. There could be other things of how they could present with their OSA. So I think we could do a better job. And this relates to your first question because why are women sleeping poorly as they get older around that perimenopausal time is because obstructive sleep apnea gets worse as you get older. And in women, because you don't have estrogen, you need estrogen for muscle tone. When you don't have muscle tone in the upper airways, then you're going to be more predisposed to obstructive apneas. So women, as they get older, have a higher incidence of OSA. But what did I say? We are doing a horrible job in identifying it. So these are multiple reasons why sleep is getting worse at night when we talk about women.
So interesting. I didn't think it.
I just blew you away with that, dude.
You did. Did you see the look on my face? I'm like, because I just had a cardiologist on the show and we talked about how women present differently with heart attack and stroke. So very, very, very interesting.
Oh, let me throw something else out there, dude. Now you got me pumped up. I am a lung doctor, but I'm not playing a sleep doctor. I do both. Do you know that we, as physicians and healthcare providers, do a horrible job identifying COPD in women? And women have a tougher course, and I just want to throw this out there. It's kind of interesting facts. People ask me, why do women have a tougher course with COPD, smoker's lungs, emphysema? Because number one, women's lungs are smaller than men's lungs. So when you damage it, you have less real estate left.
Wow.
So we got to be careful. Number two, when we were all in med school and we think of the diagrams and pictures of people with emphysema, they're all a bunch of men. We don't really naturally think about women when we think about COPD. And the last thing is, right now, we really need to be paying attention about COPD in women because we're seeing the effects of the first cigarette that was ever marketed to women only. And Michelle, I'm going to quiz you. What cigarette is that?
Virginia Slims.
Yeah.
Because my sister used to smoke those back like in high school.
There you go. And that's why we need to pay attention now. So it's not just heart, it's lungs, and it's sleep. You asked me why I came on your podcast. I definitely feel it's awesome that you're actually putting women's health forward. You're trying to point out these things because all these little things are going to help.
I don't want to be a Debbie Downer because I know we've got so much going on in our bodies and then we're not sleeping well. But are there things that, based on lifestyle, things that we can do to help, but then know that there are health professionals out there that can help us, that don't suffer in silence. That's my mantra. Get help, go ask questions. And if you're not getting your questions answered, go find somebody else who will. And I'll get off my soapbox.
No, I like that.
So in regard to lifestyle changes, a couple things we talked about, making sure you get outside, We want to make sure our room is at an ideal temperature, which is what?
Oh, nice. So let me answer that and throw one more thing out there for your other listener. If you do have obstructive sleep apnea, everyone, easy to diagnose, and it's actually it's not as bad when we talk about treatment. I think everyone's going to start thinking about that mask you have to wear on your face. You look like Darth Vader or like Kylo Ren or something like that. It's not like that anymore. We definitely have other things we could do. There's a lot of what we call dental devices, mandibular advancement devices. There's positional therapy. We could take a look in your mouth to see if you have the biggest tonsils in the whole world and give you some options. So please don't feel that it's only just me throwing a mask on your face. Talking about back to the sleep hygiene, the room has to be dark and cool and quiet. Remember, when I say quiet, everyone's individualized. Sometimes if it's too quiet, you can't fall asleep. Definitely some individuals like myself like a little background noise. My kids have a sound machine of the watery creek in a waterfall, and I love that. Some people like white noise. So there's different options. When we talk about temperature, wow, I think that when we talk about another reason why women have a tough time sleeping at night when you're perimenopausal is night sweats. It's drenching. So of course, there's different ways to cool down the room. The worst answer is crank up the air conditioner, because then your bill's going to be so high, you're going to come after me and Michelle. It's going to be what you wear to bed. And I think that for me, I love an old beat up concert t-shirt when I go to bed. It's sometimes thinking about your pillow and your mattress and your bedding, but they're expensive. But there's big money in this industry. And I never knew this. There's cooling pillows, God forbid.
Oh, yeah.
There's so many things you can do if you got the money, of course. Everyone's going to ask me, why did you say cooling as far as going to sleep? My motto is what happens physiologically in our circadian rhythm, that when you lay down, your body cools down. When you wake up, your body warms up. So you're just kind of mimic your circadian rhythm. And how do we do this naturally, everyone? Remember, Michelle, you heard of that myth or story or whatever it is, taking a hot bath before going to bed?
Yep.
So people always ask me, like, is that true? And where did that come from? So the answer is that, number one, a hot bath is relaxing. You can kind of just think about your day. Trust me, I know not everyone has a bathtub. You could probably mimic a shower. But what happens is when you leave the shower, your temperature is going to drop. And it's that dropping in temperature that's really going to help out the sleep. See? And that's where the myth came from. So cool. And when I say dark, take it with a grain of salt. Because if your room is pitch black, what's going to happen is that, let's say someone turns on a flashlight, it's going to be like, oh my God, you're really going to see it. Some people like a nightlight, and especially as you get older, I think having nightlight's important. Why? Because when we get older, no one wants to fall. So sometimes it's nice to have a nightlight. So when there is a big flash of light or someone turns on the room light accidentally, it won't be as bad. So these are just generalized rules, but always realize that sleep is very individualized.
And then you brought up the light. Let's talk about blue blocker glasses and being on our devices at night.
Well, two things. Number one, when it comes to technology, you got to put that cell phone away. And I already predict, Michelle, there's someone listening to this thinking, no way, I'm not putting that cell phone out of arm's distance. But it's not the cell phone itself. It's the Instagram. It's the Facebook. It's the email from your boss who's yelling at you. You really got to put technology away. Don't get me wrong. You need an alarm clock. Nowadays, very few people have the old classic alarm clock with the ringer and the bells. They use their cell phone. So wake up, but keep the phone away. And that's what's the hard part when I hear about reading books in bed. Most people read on a tablet or their iPhone. When I hear about apps that help you fall asleep, these apps are on your what? They're on your phone. So it's really the honor system. You're only using that technology for what it's meant for and not going anywhere else. But when you use the phone itself, it does emit something called blue light. And blue light is a specific wavelength of natural sunlight. And it's the one that actually really has the effect on that hormone melatonin being secreted by your pineal gland. And what did we say earlier is that when you have a lot of sunlight, especially blue light, it suppresses the release of melatonin. So at nighttime, why do we say shade off the blue light? Is because in the physiology sense, you do want your melatonin to be released, and we want technology to be put away so you won't be stimulated mentally. But I hate this word, in the olden days, people would have these really big orange glasses they'd wear.
I remember those.
And it was so dorky looking. But now we have things on your phone, on your app, like blue light shade that does it naturally. But yes, I think that's another sleep hygiene that's not cognitive behavioral therapy could help out a little bit.
I have one more question around sleep hygiene and lifestyle.
Yeah, fire away.
We have to talk about alcohol.
Oh, yeah, 100%. I'm always going to say this, is that I'm not anti-alcohol. In fact, when I have like a hard day of work, one of my favorite things in the whole world is to have a beer. And in fact, on my other podcast, the Dr. Raj Podcast, I'm having Guilty Pleasures Month. And I'm actually interviewing someone.
I'm tuning in.
I have a person who's the coffee dude. He's going to talk all about coffee so you could act like a snob when you go to Starbucks, you know? And then I'm going to have my beer guy, who's actually my best friend, and he's going to talk about what are the different types of beers. And so it's going to be really fun. So when it comes to sleep, specifically in alcohol, the answer is it's fool's gold. Don't do it. Don't do it. Number one, if you ask me one-dimensionally, if I drink alcohol, will it make me sleepy? Will it knock me out? Well, yes, that's what it does. But what is the downside is a couple things. Number one is the second half of the night, multiple awakenings throughout the night, not getting to the deeper stages of sleep, second half of the night, no REM sleep, second half of the night. And also for my med students, if there's one listening out there, alcohol inhibits a hormone called ADH, anti-diuretic hormone. And because it inhibits ADH, what happens? Multiple trips to the bathroom. So when your listeners are at the bar and they're drinking that 1 or 2 glasses of wine and all of a sudden they're running to the bathroom, you started inhibiting ADH. And that's why you folks call that what? Breaking the seal when you're drinking.
Yeah, breaking the seal. Very good, Dr. Raj.
And of course, never mix alcohol with any other sedative hypnotic. Don't mix it with your Benadryl. Don't mix it with your Ambien. Because only horrible, horrible, horrible things can happen. So if there's something called psychophysiologic insomnia, and I'll wrap this up pretty quick. Psychophysiologic insomnia is a terminology that was used to describe people who only have anxiety in regards to sleep, not generalized anxiety, just anxiety towards sleep. And what happens is that they start doing behaviors and actions that make the insomnia worse. So what do they say to themselves? Tonight, I'm going to go to bed 2 hours early. Today, I'm not getting out of bed, or I'm going to drink that alcohol before going to bed just to make sure I knock me out. And by doing these things, it just makes the insomnia harder to treat and last longer. So I'm glad we brought that up. And if you suffer from insomnia, the answer is not alcohol.
Okay. I had a feeling you were going to say that, but just thought I'd better bring it up. Let's talk a little bit about the Dr. Raj podcast, because you brought it up first, and I think it's definitely worth telling our listeners about.
I'm so blessed. I have a team of people that kind of like me, and this company called Inside the Boards, which is really meant for anyone in the health profession to learn about more medicine, said, let's give Raj a non-medical podcast called the Dr. Raj Podcast. And it's all about happiness and wellness. It's almost as good as your podcast, Michelle. I bring in people who just have amazing stories. And, you know, one of my guests, God bless his soul, was Bob Saget.
Oh.
And and if you ever download it, you can hear the interview. Bob Saget's sister suffered from a scleroderma, and she passed away from it. And Bob Saget's actually one of the spokesperson for the Scleroderma Research Foundation.
That's a rheumatoid type of disease, right?
Yeah.
Okay.
In summary, listeners, scleroderma is more than just very tough skin. It affects every organ in the body. And yes, rheumatologists like my wife treat it. It affects the lung. I deal with the lung portion of scleroderma. I reached out to Bob Saget. He never even knew me and said, please come on my podcast. And he said, yes.
Oh, wow.
No manager, no nothing. And we became friends.
Oh.
He actually wrote the foreword for my new medical book. I'm not joking. And then literally after all this happened, a month later, he passed away.
Oh.
But, you know, when I hear all these things about him, I only knew him for one thing, that this really generous, nice dude that went out of his way to help me. And he's on the podcast. Other really nice, influential people are on there. So please check it out.
Okay. And I'm going to put that in the show notes. And then I will also put any other places like social media where people can find you, because that's where I found you. Now, I do have one more last question.
Sure.
It's a biggie. So you went to Michigan State for your residency, and now you're at USC. So if these two schools play each other in a Big Ten game, who are you rooting for?
I love that question. You know what really got me into sports is being part of Michigan, the state in general. The people in Michigan are awesome. I love people in Grand Rapids. I love people in Michigan. I did some training in Detroit also. God bless Detroit. So I became a sports fanatic, and I realized collegiate sports is important because I was a Spartan through and through. But to answer your question directly, right now, because my higher ups are listening to me, I got to be a Trojan, man. I'm sorry.
Okay. A thought-provoking question for our listeners and something for you to ponder, but it sounds like your mind's made up. Dr. Raj, thank you so much for being on the show today. I truly appreciate it. I got some great pearls and nuggets here. I'm going to put together really good show notes for our listeners, and thank you again.
Oh, you're super welcome, Michelle. And you know what? I imagine you're going to be on my podcast probably coming up soon. So I'm excited to have you there too.
Follow Asking for a Friend on social media outlets and provide a review and share this show wherever you get your podcasts. Reviews and sharing help us grow.